We have a fantastic speaker for you. Dr. Sue Hassmiller is here to speak to us. Dr. Sue Hassmiller joined the Robert Wood Johnson Foundation in 1997 and is presently the Robert Wood Johnson Foundation Senior Advisor for Nursing. In this role, she shapes and leads the Foundation's nursing strategies in an effort to create a higher quality of care in the United States for people, families, and communities. Drawn to the Foundation's organizational advocacy for the less fortunate and underserved, Hassmiller is helping to assure that Robert Wood Johnson Foundation's commitments in nursing have a broad and lasting national impact. In partnership with AARP, Hassmiller directs the Foundation's Future of Nursing Campaign for Action, which seeks to ensure that everyone in America can live a healthier life, supported by a system in which nurses are essential partners in providing care and promoting health. This 50-state and District of Columbia effort strives to implement the recommendations of the Institution of Medicine's report on the future of nursing, leading change, advancing health. Hassmiller serves as a report study director. She is also serving as co-director of the Future of Nursing Scholar Program, an initiative that provides scholarships, mentoring, and leadership development activities and postdoctoral research funding to build the leadership capacity of nurse educators and researchers. Hassmiller serves with the Health Resources and Services Administration as Executive Director of the U.S. Public Health Service Primary Care Policy Fellowship. In this role, she addressed national and international primary care initiatives. Her work has also included service in public health settings at the local and state level, and she taught public health nursing at the University of Nebraska and George Mason University in Virginia. Previously, she was a member of the National Board of Governors for the American Red Cross, serving as chair of the Disaster and Chapter Services Committee. She is now a member of the National Nursing Committee and is immediate past board chair for the Central New Jersey Red Cross. Hassmiller is a member of the Institute of Medicine, a fellow in the American Academy of Nursing, and sits on other advisory committees and boards. She is the recipient of many awards and 2 honorary doctorates, but most notably the Florence Nightingale Medal, the highest international honor given to a nurse by an international committee of the Red Cross. Please help me welcome Dr. Hassmiller to the stage.
Okay. I know when Florence Nightingale gets mentioned, that's the cue. She's the most important nurse still, right? She really is. So it is such a pleasure to be here with my people. You are my people. So I'm so happy to be here. Shirley, thank you for inviting me. And I know that I have in the audience some of our, just keep standing, Robert Johnson Public Health Nurse Leaders, Breakthrough Nurse Leaders, stand up, stand up, stand up. Action Coalition, who am I forgetting? Lisa, you're with the Georgia Action Coalition. They're not listening. They're talking about their award that they just won. They can't move on. No. And then I had the pleasure of sitting at a table with these 2 young ladies who informed me that they had received last year, the Robert Wood Johnson Foundation Culture of Health Prize. And so, congratulations to them. They're from Richmond City Health Department, and it takes a lot of partners. I know how hard it is to get that Culture of Health Prize, so I congratulate you as well. I try to encourage everyone, nurses especially, so talk to them. See how your city, your county can be a prize winner as well. Okay, so I have a lot of buttons to press. I have to hold on to this because they're recording it, and I don't have an outfit that has any pockets or anything, so I'm going to hold this and press buttons at the same time. So you've seen this one before. I know you've seen it, but it is a way to talk about the social determinants of health, isn't it? And it's so interesting. What didn't get mentioned, and I'll mention a little bit later, but I'll tell you now, that I was very involved, right, with the first Institute of Medicine Future of Nursing report. And that report instigated this whole national campaign that Lisa talked about, action coalitions in every state. And because of the work of the Robert Wood Johnson Foundation moving towards addressing a culture of health and social determinants, we have now had the great pleasure, I have had the great pleasure, of now going back to the National Academy of Medicine and helping to lead another report on the future of nursing 2030. And it really has to do with the role of nurses in addressing social determinants and health equity. So we're going to have a brand new report at the end of 2020. See, I said it at the beginning, I just couldn't wait. There's a slide further down, but I just couldn't wait, and I noticed it didn't get put into the, no fault of yours, through the introduction. But when I do all of this future of nursing stuff that I have been doing over the last 10 years, it always strikes me as bizarre because, you know, this is really where nursing started, isn't it? So I always wanted to call all these reports nursing back to the future, back to the future, because that's what we keep seeming to do. This is all new to a lot of people, all this talk about social determinants and health equity, but you know, remember Lillian Wald, right? So we know that about 80%, and I'm glad that this is getting on so many people's radar screens and students and everybody. Wow, really? This affects health? Transportation affects health and housing? Yeah, it does. About 80% of our health and well-being can be attributed to all of these things. So, here's what we're doing. About 4 or 5 years ago, and you heard that I had been at the foundation since 1997. I can't believe that I had been there that long, but I've been doing sort of different things, including starting a public health team at the foundation probably around 15 or more years ago, and that's when Brian was an intern with me at the foundation. So it was great to see him today, and I'm so proud of him. But with all the work that we have been doing at the Robert Wood Johnson Foundation, with a lot of people, mostly physicians in the beginning. When I came there to work on physician workforce development and primary care, because that's sort of what I was doing at the time at HRSA. But you know, with all the research the foundation was doing, they decided to follow, being an evidence-based organization and a think tank, they decided to follow their own research. All of these people that were doing research for us, it just kept coming back about what was really leading to health and well-being in this country. And it wasn't necessarily some of the things that we were funding or convening or doing research on at the time. So we moved slowly, about 4 or 5 years ago, to this mission that we call Building a Culture of Health. And it's really meant to provide everyone in America a fair and just opportunity for health and well-being. I always add the word well-being. You know, sometimes our foundation talks about everyone being healthy and everybody's got to be healthy, but we know that it's not possible for everyone to be healthy in this country. Some people, as I learned a couple of years ago, never actually walk out. My husband, I lost my husband, never walk out of the hospital room again. So encouraging or engaging families and patients around a sense of well-being, and even if they can't be like jumping jacks and community gardens, is really important to me that I always include that word well-being. Health equity, we talk a lot about health equity, and you know, it's really interesting because we have a very large communications department at Robert Wood Johnson Foundation, and when we got into all of this work, probably about 2 years ago, you know, we want everyone to be involved, right? Health is a shared value. We know that not everyone is going to be healthy and well if not everyone in this country really understands health as a shared value. We all have to think that this is really important to make this happen, right? And what we learned was there's certain language that not everyone gravitates towards. I will just say it that way. Like if you use certain language with certain groups in this country, like disparities or, you know, even sometimes health equity. But if you explain, we found through lots and lots of focus groups, if you just explain what you mean by some of these buzzwords, then it makes sense to everyone. And remember, the goal is health is a shared value. So health equity to us is really just ensuring that everyone in this country has a fair and just chance as being as healthy and well as the next person. Just say it like that, right? And we know it takes so many partners. Again, you know, when I came to the foundation, again, a lot of focus on physicians, physician workforce, physician this and physician that. And then eventually, I got to work on a lot of nursing stuff, as many of you know. You know, sometimes they say when a window opens, you got to jump through it. And boy, I jumped through it and brought some people with me, and it's been exciting ever since. But our work at the foundation, I want to say I'm going to say limited in working with certain partners. When we started working on building a culture of health in this country and really getting our arms around, everyone's got to be involved, right? Everyone's got to be involved. We started working with so many different sectors that we never thought. And that's what I asked Lisa and the Action Coalitions know. If you're really going to be successful, if you're really going to make a difference in this country with policies, with programs, get as many people involved and engaged as possible. And so our foundation, if you ever go to our website, and I hope you do, rwjf.org, you will see it's all about a culture of health, and you will see you know, business community and faith community and NAACP and you know, Heart Association. We are working with so many sectors in this mission that we have. And I would say that about 2 or 3 years ago, I'm going to say about 3 years ago, as our foundation was collecting all of these sectors to work with, I started thinking, oh my God, we cannot leave nurses behind. We cannot afford to leave nurses behind because they are really key and central in ensuring health and well-being in this country, and I really, really believe that. So many sectors, many partners, yes, indeed, but we got to want to keep up with everyone. We've got to make sure that we are, and I'll get into all of this, but we got to make sure that we are having a voice and being at the table and all those things that we always talk about. But I've never felt it has been more important than now. I feel like there's a lot going on and a lot at stake in this country with what's going on, and we've got to be that voice of reason and that voice of health and well-being. Speaking of health and in all policies, we do a lot of grant making around this because as Brian, if you listen to his presentation this morning, it's really quite important. Yes, everything is important, doing programs and working one person at a time, working with groups and communities. But if you work with policies, you can really have great effects. We learned that at Robert Wood Johnson Foundation with all of the work that we did on tobacco cessation prevention. We were the foundation really behind putting tax credits in states as a policy. Really, really important. You can affect a lot of people, and I know you know that with that. Just an example, a walking school bus. You know, another example, I looked at some of these slides this morning and I kept thinking, I mean, you know, I did that when I was a kid. Everything is back to the future. Now we need a policy. Now we need a policy on kids walking to school with chaperones and making sure they get there safely. I get it. I got 2 grandchildren, 2 and 5 years old. It's not the same as when we played and, remember your mother just said, just be home by dark, right? Does anybody remember that? Just be home by dark. And that's the way it was. It's just not that way now. Priority Spokane. Where's our Washington folks? I know we have Washington folks here. Yeah, there you are. Yeah. So we found this example really important. It's an example of a city that was tracking itself through measures, as a lot of cities do. And if you don't know about, everyone in this room must know about county health rankings. You do know about that, right? And are using that as a tool, a very important tool. If you don't, rwjf.org, you can go to countyhealthrankings.org as well. But this particular city looked at their graduation, their high school graduation rates, and compared to many other cities, I don't know in Washington, but certainly across the country, their graduation rates were really low, and they decided to do something about it. They brought a lot of sectors together, many, including the health department and the school system, and they advocated for state laws promoting restorative disciplines as opposed to punitive disciplines. And they did many things. And now, instead of a 60% graduation rate, there's an 80% graduation rate in Spokane. So if you have the patience, and if you work really hard, as you said with your Culture of Health Prize, you're seeing your indicators creep up, right? You just have to work hard and be patient and keep everybody at the table, and it will happen. So this is another thing that Brian mentioned this morning, this Public Health Workforce Interests and Needs Survey. I found this really interesting because I have to read this. Let me see. This survey found that 40% of public health department employees had never heard anything about health and policies. 40% of all public health departments surveyed. 25% they hadn't heard that much. Okay? So this is, it's just, you got to take it in stride and figure out then what to do with it. This other graph is something that Brian showed this morning as well, that showed that nearly 60% of all health departments in this country do believe that their agency should be very involved in health equity. And I noticed that Brian had it turned around. But if you look at the other indicators, 60% of health departments believe that they should be involved in the work of health equity. But if you look at those other indicators that really drive towards health equity, it's not as, they should all align. They should at least all align, but somehow there's not a connection being made. So here we go. Why should nurses address social determinants of health? Because Lillian Wald said so. That's all you need to say. Really, if you know what she did, I mean, she worked with the school systems and the business community. I mean, the partners that she worked with to get the work done was incredible. And all we have to do is hearken back to the future. But why should nurses address social determinants? It's really who we are, and that's what I try to convince nurses now. Even nurses who are graduating from nursing school, and blasphemy, has never heard of Lillian Wald. You gotta sort of make that connection with people, and know that it is who we are. It's part of our DNA. It should be part of our education. It's not always. We're doing a big study to determine which schools of nursing in this country are doing it and which really are not. We have those. We have our phase 1 results on rwjf.org. Our Public Health and Nursing Catalyst report. You can look more about schools of nursing and what they're doing. But it is our DNA. We know that we provide holistic care. We're educated and trained to understand the context of a person's life and how it affects their health. We do get a lot of that in school, and then what happens, it's sort of beat out of us, or in the systems that we go to work in don't support this. So nurses, and we're taking on more roles. I'm really excited about this. Public health departments, this is really their bread and butter. But health systems in this country, because of all the value-based payments and this, this impetus on population health, large hospitals and health systems are really trying to get their arms around this. Some are doing it much better than others, right? So we know that, so for example, Kaiser, California folks in here, Kaiser, United Healthcare, there's a large contingent of health systems, hospitals in the Portland area. All of these health systems have come together to pay attention in their own way to housing. And I think it's a really good thing. And they are trying. They're not getting it just right, but they're moving in a direction that is promising. I had somebody, I won't say her name, but you'll know who you are when I tell this story. But I had someone come up to me earlier to say that she was leaving her post in public health and going on to take a position, probably, in a large hospital and health system, and was feeling kind of, how it is, guilty and what will people say about me kind of thing. But I will tell you this, those people need all the help they can get. They really can. I'm on the board of the largest health system, largest hospital and health system in New Jersey, the Hackensack Meridian System. Anybody here from New Jersey? Okay, so you know the health system very well. I'm on that board. And, then I'll have to be careful. But they need help. I'm just telling you, they need help. They need people with extensive public health experience to come into their system. Otherwise, these words are thrown around, and who's handling their population health are insurance people. Right? You know that, right? Some of the health systems are doing it better than others. So I love this example. Sarah Zanton, one of our nurse faculty scholars, and she started her research when she was a nurse faculty scholar at Johns Hopkins. And what she did was she focused, this is a program called Capable, and what she was really interested in is why people return to the hospital so fast after they were discharged. This is costing us a lot of money, right? It's costing us a lot of money, and hospitals are getting zinged. They're getting a lot of penalties because of these returns back to their hospitals so soon. So she did research and found that, I love this example because it's so true. I really find this to be true, that what do you need to stay in your home and age in place? A good nurse, a handyman, and an occupational therapist. And she has wonderful outcomes. Let me see, I think this next one. Yeah, she has wonderful outcomes. 75% of participants showed improvements in daily living. And this program is saving Medicare so much money, and now it is being adopted as a program and policies in different insurance companies around the country. So why else? Nurses are fully prepared to serve as partners and leaders. So I hope that most of you, if not all of you, know what we have been doing over the last 9 years with the Campaign for Action. A lot of very important recommendations, I would say, to help build nursing's capacity. Go back to school, right? Get a baccalaureate degree, and this all came out of the Future of Nursing, the first Future of Nursing report. Go back to school, get a baccalaureate degree. We don't have enough doctoral prepared nurses in this country. We need more faculty. We need to expand the practice authorities in the states so, God forbid, people can actually practice what they learned in school. What a novel idea. Improve workforce diversity. So we've spent a lot of time over the last 9 years building the capacity of the nursing workforce. And with this new report that's coming out, because people ask me, is this the future of nursing 2.0? Didn't we just get it right the first time? sort of thing. And I don't think my foundation would have given me all of this money to do this yet again and then go to the Institute of the National Academy of Medicine, where I am now, to focus on this. If we were going to do 2.0, we just sort of didn't get it right. Here's how I explain it. We shouldn't stop our capacity building. We shouldn't stop nurses from going back to school and being more diverse and enacting full practice authority in their state. No, all of that work still needs to be done. We're not done, but you know what? We made a lot of progress. In the meantime, we have all of these indicators, right? If you look at all of our health, morbidity and mortality and life expectancy, all of those indicators about our country, they're just not good. They're not good. You know, I used to say that this country's life expectancy was sort of 43rd after Croatia. And now, last year, the new indicator came out that we're last. I mean, how can this be? People who live in a bubble, especially those who are not working in public health or even health, well, I'm going to take that, I'm going to say public health, are living in a bubble and they think, how can these indicators, morbidity and mortality, you know, all of those indicators, how could that be in a country as wealthy as ours? But it is, and that's reality, and we in this room know why, don't we? Things are not equitable. For a small number of privileged people at the top, we do have perhaps the best health care in the world, but it's not equitable. All boats should rise. And with this new report, what I'm saying is that we have this capacity that has been built in the nursing workforce, and now to what end? Now to what end? Let's take that capacity. Let's take everything we've built over these last 10 years. Everyone has gone back to school. Everybody has, you know, who's gone on a board. Let's take all that capacity and now apply it to doing something with these indicators. So that's what the next report is about. It's really about the role of nurses in addressing social determinants and health equity in this country. And that's what I am so really proud to be working on and bringing everybody along as well. Polly, I hope you will take a look at a paper that we commission that is, and we commissioned for this new committee, the National Academy of Medicine Committee on the Future of Nursing 2030. I commissioned Polly Pittman. She's an extraordinary thought leader. She's a medical anthropologist, but she's a wonderful thought leader on the healthcare workforce and nursing. She's done a lot of work on nursing. So I asked her to do a paper on the social determinants and nurses' role. And a lot of these next couple of slides come from that paper. So I hope you'll go to the website and look up that paper. You'll be able to use a lot as well. Here's one. We know what social determinants. We did a lot of focus groups as well to prepare for the National Academy of Medicine Committee. We did a lot of focus groups. And we learned that nurses in our country, they do understand that there are, this is what they can say, and I'm saying public health, acute care, administrators, we interviewed lots of people, individual interviews and focus groups. So here's what nurses say. They know that there are inequities. They're very frustrated, in fact, that no matter where they're working, that even though they see it, they're very frustrated that they can't do something about it. They may or may not have learned about it in school. Some students are coming out with a firmer experience with social determinants and health equity. But nurses are saying too, we have so much to do, whether they're acute care, home health, long-term care, Nurses are not actually playing cards, right? We've already established that. But just the opposite of what nurses told us all over the country, that they are so busy and overworked and trying to complete so many tasks in a day that they're a little bit worried. I'm just telling you this. They're a little bit worried about more being put on them. They want to address the social determinants, but if it means more time, they don't know if they can take that on. But they need a means, they need toolkits, they need a system that supports them to really follow up on what their heart is telling them that they need to help that person or that community, because it's just not working. And that's what the nurses are saying around the country. How to get nurses to address the social determinants. Again, this is from the Polly Pittman paper called Activating Nursing to Address the Unmet Needs of the 21st Century. Really, really important paper for everyone in this room to get a hold of. You know, Polly found that we have our core nursing functions, and we're learning these things in school. You know, let's just take assessment, for example, because that's a really important core function and skill that we have to know about and hone, especially when it comes to the social determinant. So we need to strengthen that. Again, not only individual, but we need systems to support us in this. We need to embrace our idea of working at the intersection of other professions, a really strong message. And then bolster nursing education, which I told you about earlier. We know at Robert Wood Johnson Foundation that it's not equitable around all schools of nursing, and our aim is to help do something about that. Education, employers, policy leaders should work with nursing leaders to create jobs with roles that allow them to do address social determinants and health equity. Align payment and regulatory policies with goal of transforming healthcare system. I will tell you, in working in a large healthcare system, my board position, not my Robert Wood Johnson position, and knowing what's going on in the country, I am heartened, although we've sort of hit a momentary, I hope it's momentary, a stagnation in which this country is attempting to move more toward value-based care. So we know that the more that we can pay for value, and there are systems involved and being capitated around value, we know that those are the systems that are motivated to bring in innovation and nurses with new roles and helping them achieve that and not get penalized, right? It's all about, I'm sorry, it's all about the money, isn't it? It's all about the money, but that's okay, as long as we're moving in the right direction of value-based care. It's really, really important. So here's, so I told you about this. I told you I couldn't wait. I was so excited to tell you. But I am there now at the National Academy of Medicine every week in Washington, D.C. We have a committee. This is a consensus report. And we have two co-chairs. Mary Wakefield is a chair. Some of you know Mary. And then David Williams. Really important to me to have had a co-chair that really understood very, very deeply about the inequities, the injustices, the racial injustices in this country. And that person who is serving that co-chair position is David Williams. He's an African-American sociologist at Harvard. And the balance is just extraordinary. We have a wonderful committee. This committee will conclude its report at the end of 2020. At the same time, we are celebrating. We will celebrate all of the achievements of the Campaign for Action. That is when we will then launch this new report on nurses addressing social determinants and health equity. I hope that some of you will be able to come to our town hall meetings. We had our first big meeting in Washington, D.C. These meetings, you can come in person, but they're filling up fast. There is a limit to how many people we can have in the room in Chicago, Philly, and Seattle. But it's also going to be webcast. So go to the National Academy of Medicine, Future of Nursing 2030, and you can sign up for all kinds of events we'll be having and the information on the town hall meetings, okay? You've heard a lot about nurses on boards. I know that Lori Benson was here yesterday, our wonderful leader for Nurses on Boards Coalition. But I'm really excited. When we started this work around nurses on boards, we were still into implementing the recommendations of the first report, all of those things that were helping to build our capacity. And I'm even more excited about the nurses on boards work because with our culture of health and in every way that we've expanded our work, that is how we're also expanding the boards that we're going to as well. So we're now telling nurses, you don't have to just be on a health system board. You can be on a school system board. You can be on a board that has a food pantry. I remember I was giving a presentation a couple of years ago, and I was talking about nurses on boards, and I was leaving the room, and this one woman came after me, and she said, because I think I asked for a raise of hand who was on boards, right, nurses, and so she came after me and she said, I didn't raise my hand because I didn't know if this is what you were looking for. And Shauna, you'll understand what I'm talking about here. She said that I worked during Katrina. I was a disaster worker during Katrina. And if you weren't there, I was there too because I'm very involved in the Red Cross. But you at least remember the commercials, not the commercials, the news that when it showed dogs and animals being chained to the porch and who's taking care of all of these animals. And we know from research and disaster research, people won't leave their homes if they have to leave their animals, right? And it's a very, very, very important policy. Having animal shelters. And so this person came after me. She said, after my work in Katrina, I did a lot of work with the National Humane Society, and now I'm on the board. And she said, I hope that counts. I said, oh my God, that counts in a really, really big way. So that's what I mean. And all of these policies that are being developed, not just for disaster, but for transportation and social isolation and food insecurity and trauma, all of these other policies and boards that are meeting all over the country who don't have health, a voice of health or a voice of nurse, something's going to be missing. And there are a lot of policies that are being made that are wrong because they made it without the voice of health and without the voice of a nurse. So we must be there, right? Our goal is 10,000 nurses on boards by 2020. I now have an up-to-date count from Lori Benson. As of yesterday, we are nearly, just a couple of people, we're nearly at 6,000. So I'm hoping that somebody in this room will go onto Nurses on Boards coalition.org and sign up if you are on a board, and if you're not, you can say that you want to be on a board, and we'll help you. I'm going to skip over. So I wanted to show one, let me see if I can get this.
As a little 9-year-old girl, I was hospitalized with rheumatic fever. During those 3 months, I got to know the nurses very well. And I discovered the nurses in the morning read the notes, so I had to stay in bed on bed rest. The nurses in the afternoon didn't, so I made rounds. I saw all the patients. I helped them with bedpans. I get water for them. I share my food. I decided then and there that I wanted to be a nurse, just like those nurses who took good care of me. As a nurse, you see the conditions of patients coming in to the facility. You see the pain. You see those with insurance and those without insurance, those struggling. And I always say there ought to be a law against this and there ought to be a law against that. And so one day I was bathing a patient because I was the nurse, I was in charge nurse that day, but we were short staffed. And as I went to wash under, she had a fracture. So I had to go under her axilla to wash under her arm. And as I went to wash, I felt her breast. It was hard as stone. And I looked at her and said, "How long ago your breast has been like this?" And she said, "For quite some time, had to be some time, but I had no health insurance. And I had no health insurance and I didn't know what to do." So I looked at her and I said, "This compound fracture is not what is important right now. It's your breast." I watched her lose the first breast, the second breast, through chemo and radiation until the day she died. And I swore then that I was going to run for political office.
So who here is from Maryland?
I was just getting ready to say.
You know?
Beyond.
Do you love her?
Beyond amazing.
You love her, yeah. She is a state senator from the great state of Maryland. And yeah, so yeah. Let her know that she was applauded. Let her know. Just like Lauren Underwood, where's Illinois here? Even if you're not from Illinois, you should know about Lauren Underwood. She's the youngest person of color nurse to have ever run in a district against a 4-term white man and won her race, and she's doing amazing. Lauren Underwood, you should look her up as well. But we have some wonderful examples in this country, and we just need to keep inspiring all of us together. Massachusetts Action Coalition, talking about being on boards. I love what they're doing. They're doing a lot around school health, and they've made a decision, a statewide decision, to get a nurse on every school wellness committee in the state. And I think by law, Massachusetts does have school wellness committees built in. Anybody from Massachusetts in here? Okay, yeah, of course you are, right? So you could stand up here and talk about this, but I think it's really, really important to be on a school wellness committee, work with the teachers, the administrators, the school nurses, and everybody in the community that they ought to be working with on school health. And they're working on vaping right now, for example, as one of their many things. So we need you. We do need people who understand, not just staff nurses, but people in managerial roles and leadership to understand that nurses have this skill, they have this area of expertise, but they need this system to support them in what they know to be is right for humanity, right? You know that. And we want to do that. We just need system support, and we need schools that are teaching this kind of stuff too. We need to partner with others on community initiatives, work at the intersection of health and other fields. Shirley had me do an interview this morning, a podcast. I guess it will be coming out, it's a video too. So one of the questions they asked me was, you know, what is your best advice for public health nurses in getting more involved in this work and making this happen? One of the things I said was, we have to get out of our comfort zone. We do. And public health nurses are better than most nurses in this country, right? But still, I've interviewed a lot of public health nurses and the work that we've been doing. That comfort in being with our own people. Didn't I start out saying today, I'm so happy to be with my people? I love it. I love being with my people. It's so comfortable being here. But to make the biggest impact, we have to be working with business and the faith community and all these other people that we know have great influence. And we just have to find a way of sharing our value with those other sectors and vice versa, and we can move mountains. And then again, I said, get involved in non-nursing and policy making. So I mentioned earlier that I am very, very involved in the Red Cross. So of course, in addition to Lillian and Florence being my heroes, Clara Barton is also my hero. Clara Barton was not a nurse. She's very often portrayed as a nurse because she was in the field doing all that. But she was actually what? She was a teacher. She was a teacher. She was a school teacher. I don't think she corrected many people when they called her a nurse. But anyway, she did great work. But I love this quote from her. I have an almost complete disregard of precedent and a faith in the possibility of something better. It irritates me to be told how things have always been. I defy the tyranny of the precedent. I go for anything new that might improve the past. And isn't it interesting? I keep saying we have to bring the past forward. So it's both. We have to improve the past and in some ways bring back some of our past. So very ironic. I thank you so much for having me here today, my people. And let's all go out and do good work and come to some of my town hall meetings, okay?